Good morning. Before we discuss our topic on hemorrhagic stroke, let us first have a short review on TIA and ischemic stroke. This was our topic yesterday for our discussion. For TIA or transient ischemic attacks, and we also have your ischemic strokes, they both have similar causes and they may be due to thrombus formation in the cerebral artery, or this could also be due to an emboli that has been stuck or has been dislodged from a certain blood vessel and eventually it getting stuck into a cerebral artery. This would now cause hypoperfusion on a specific portion of the brain. What else? They would both have the same effects in the neurologic system of our patients. So they would have aphasia, they would have hemiparesis or hemiplegia. However, as to their difference, in TIA, the symptoms only last for less than 24 hours. So from the word transient, temporary lang siya. So there is still reversible or the signs and symptoms are still reversible. Compared to your ischemic stroke, they may not be reversible already. This because there is already infarction or death of the tissue affected by the thrombus formation or the emboli. In the case of your TIA, there is no infarction or there is no death of tissues. Let us now continue with the medical management for ischemic stroke. For ischemic strokes, we usually give anticoagulants or blood thinning agents. Examples of this are your TPA or your tissue plasminogen activators. So again, as their action, they will now start dissolving blood clots that have been stuck in the brain that is now causing the stroke. This is again for ischemic strokes only and not for hemorrhagic strokes because they tend to cause heavy bleeding. If we give it to patients with hemorrhagic stroke, because in hemorrhagic stroke, our problem is bleeding in the brain that is now increasing the intracranial pressure. If we give them these medications, mas lalong magbe-bleed, mas lalong tataas ang intracranial pressure. This can eventually lead to coma and eventually death of our patients. So it's very important to know what is causing the stroke of the patient. So we also have here in TPAs, we have to give them within 3 hours after onset of signs and symptoms of stroke. Why is it important that we give them within 3 hours? It's because time is very crucial in this case so that we can possibly reverse the effects of the stroke or at least save the brain and prevent further damage or further hypoperfusion in different parts of the brain affected by the stroke. Remember, in your FAST, we have here F stands for F. We will have to look at the face of our patients. If there is drooping in one side of the patient's face, this can be an indication of stroke. What else? We also have here A. A stands for the arms. You'll ask your patient to raise their arms. If one of the arm is moving down or is unable to maintain the position of being placed upwards, that is what we call your arm drift. Arm drift, hindi kayang mag-sustain or ma-maintain yung upward na positioning ng kamay. So what happens? That is already a sign of weakness, which is also a sign of stroke. We also have here in your FAST, your S. We now look into or we observe the speech of our patients. If they have slurred speech or they have difficulty talking or communicating, that could be an indication of stroke. And for T, that would now refer to time. We have to immediately refer to the patient to the physician so that they can address the problem immediately and give medications and other interventions. Because again, as fast as 5 minutes, in only 5 minutes, this can eventually lead already to neurologic dysfunction. So we have here 3 to 4.5 hours naman, pwede nating leeway for TPAs if it meets the criteria. So again, we have to give TPAs immediately, dapat within 3 hours. However, we can still give TPAs to our patients kahit 3 hours na ang lumampas or 4.5 hours after onset of signs and symptoms, provided that the following are present in the patient. There is a negative CT scan in the patient. What else? Laboratory of the patient is within normal limits. Examples of laboratory findings, normal glucose, and then we also have here clotting factors such as your INR, and you have there. Yan, ito. Sana yung kamay ko? Where's my, yan. We have the INR and the platelets. These are your clotting factors or indications kung normal ba yung blood clotting ng pasyente natin. If ever hindi man sila or nasa abnormal limits sila, at least ma-address muna natin making sure it is within normal limits after intervention. We also have here controlled BP, a BP of less than 185 over 110. So usually we also give them antihypertensive medications. And the patient has not recently received any heparin or other anticoagulants. So this would be our criteria before we can give TPAs even if it is after 3 hours. So kung after 3 hours siya, provided that it is within 3 to 4.5 hours, and provided that we meet the following criteria we mentioned here. Ayan, yung criteria na yan. Okay, let's now continue with other management for this one. For TPAs, it's very important that we check bleeding. Again, these are anticoagulants or blood thinning agents. So they are more prone to bleeding. What else? We have to check for neurologic function tests round the clock. So dapat round the clock or 24 hours, we're continuously checking the neurologic function of our patients, especially just after a stroke. BP medications for hypertension, vital signs of course, laboratory findings, glucose levels of our patients, and we have to prevent injury. Again, making sure that we allow bed rest for our patients, especially post-stroke. Avoid IM injections because they can lead to formation of blood clots. And usually our patients are placed on ICU, especially if recent lang yung stroke ng pasyente natin. Okay, let's continue again with a rundown of the different nursing interventions for ischemic stroke. So vital signs, of course, blood pressure, heart rate, and respiration rate is very important. We have to take note of these ones because we are trying to watch out for signs of high or elevated intracranial pressure. High intracranial pressure or elevated increased intracranial pressure is it is a medical emergency that we have to address immediately. Kailangan nating i-address yung pagtaas ng intracranial pressure because that's causing further damage to the brain. So how can we, or what is an indication of increased ICP in terms of results in the vital signs? We have what we call your hyperbradybrady, hypertension, and we have bradycardia and bradypnea. So these are our signs of increased intracranial pressure. So we have hypertension, that is the hyper there. Yung brady naman is bradycardia, and yung brady na isa is bradypnea. So mababang RR, mababang heart rate, pero mataas ang blood pressure. So that is an indication of increased intracranial pressure. What else are other signs of increased intracranial pressure in patients with stroke? We have here sudden nausea and vomiting without any known causes. Hindi naman nagsusuka yung pasyente dati pero biglang nasuka yung pasyente. That could be because of increased intracranial pressure. What else? We have decreased level of consciousness in the patient and there is already problems with or abnormal pupillary response. Other things we need to focus on would be airway of our patients. We have to check the swallowing of our patients, making sure that the patient is able to swallow. We have to watch out for aspiration of fluids and the saliva of our patients, also the food of our patients. So it is also important that we have our suction machine at the bedside. Cranial nerve assessment. So we're going to assess the pupils. So again, we mentioned that increased ICP could have an effect on pupillary response. So we're going to shine a light over the pupils, making sure that it will start constricting after light has been shown there. If we remove the light, nagkakaroon ng dilation. We also have here swallowing. It is very important that we test the swallowing reflex of our patients. Facial gaze. So in this case, we have to make sure that the patient is able to follow yung object na pinapakita natin sa kanila. Gag reflex, we have to elicit that, making sure that the patient is able to vomit just in case nagkaroon ng aspiration. And other cranial nerve assessment. Bladder and bowel function, there are two ways or there are two effects of stroke that could either be incontinence or retention. Retention, there is already retaining of urine in the bladder. So we would have to catheterize our patients who would have retention as an effect of stroke. For incontinence naman, of course, yung paggamit ng diapers or condom catheter na meron ng urine bag. We also have here skin and limb integrity. Patients after stroke would have increased or high risk for bed sores, bed ulcers, and any problems with their skin integrity. So it's very important that we maintain activity. What else? We also have to make sure to avoid any moisture on the skin. For ROM exercises, that is every 4 hours. Lug rolling or changing of position in our patients, that would be every 2 hours. And we also have here your neglect syndrome. We mentioned about this one. You forget or the patient's affected side is forgotten. So for example, yung nakikita niya, for example, yung affected na brain niya is the left side. Left side head injury. So ibig sabihin yung right side niya yung affected. So ibig sabihin, hindi niya nakikita yung right side. Hindi niya nakikita yung right side. So that is what we call your unilateral neglect or your neglect syndrome. Ang pinaka-common na nagkakaroon ng neglect syndrome is when there is right side head injury. So kung right side ng brain ang affected or yun yung part na nagkaroon ng stroke, ang affected side of the body would be your left side. So in this case, the patient would usually forget na meron silang left side. So ang problema dyan, people or the patient will now start bumping into objects found in the on the left side, kasi nga hindi nila nakikita yan because of the neglect syndrome. Pag kumakain rin sila, mapapansin mo bakit may pagkain dun sa left side, it's because they actually forget about that. They don't see that part of their visual field. So it's very important that we allow them to look into the whole or their overall visual field. So how can we do that? By reminding our patients to use and touch the side of the body that is affected or being neglected. What else? Instruct your patients to scan their surrounding with their eyes. So pag, for example, dun sa right side, let them look at their left side also. We also have here your hemianopsia. We mentioned that hemianopsia would now refer to problems with half of the visual field. I showed to you an illustration of bitemporal hemianopsia kung saan yung outer visual fields of the patient, outer half of the visual fields of the patient is affected. Yung nakikita na lang nila is narrow na visual field. What else? We also have here your homonymous hemianopsia kung saan same side. So kung right side ang visual field ng left ko ang hindi ko nakikita, ganun din dun sa may right eye ko. So nakikita ko lang ditong side. So this is hemianopsia. This is very important. We have to assist our patient when they're trying to walk. Eye patch is also important kung medyo nahihirapan or nagkakaroon ng hyperexcitability or irritation dun sa mata ng pasyente. For diet naman, it's important that we thicken our fluids. We try to avoid yung super watery na pagkain or super watery na drinks. It's because this could lead to aspiration in patients because of problems in swallowing. We also have here crushing of medications. Usually we mix that already with our NGT feeding. And we also have mechanical soft foods. So foods that are easily chewed by the patient is also important. And then we also have here below, assisting the patient in eating through NGT feeding. So those are our interventions. Meron pa ba? We have here, ayan, communication naman. One of the effects of stroke would be aphasia or problems with speech. There are two main types. We have receptive or expressive aphasia. In receptive, receive. You are unable to comprehend or understand short phrases and simple details, or speech that has been given to them. So if you're going to talk to them, hindi nila kayang i-process. What else? Inexpressive naman, they're able to understand what you are telling them. However, they are having a hard time talking or trying to communicate what they have understood from what you just said to them. So for your receptive, very important na nursing intervention is to use short phrases and simple details. So when you're giving them instructions, dapat short lang. Use gestures and point as much as possible. So if you're going to show, ma'am, are you going to wear your slippers? You're going to point to the slippers. Be patient with your patients, of course, because they would have a hard time understanding speech. We also have here removing distractions, making sure na simple lang yung surroundings ng pasyente so that they will not have a hard time processing all of the information in their environment. And it is very important also to repeat what you will be instructing your patients or repeat what you are saying so that they'll be able to understand the information being given to them. Expressive naman na aphasia, in this case, the patient is able to comprehend, but they would have a problem responding. So there is slurring of speech or inability to talk. So in this case, you also have to be patient with them. Let them speak. Kahit slow, medyo nahirapan sila, still allow them to speak. Don't rush your patients. Huwag mong pilitin na bilisan nila yung pagsalita nila. It's because there is already problem in forming their speech already. Ask one question at a time. Be direct and make sure ask questions with simple options or responses. So parang dun sa toddler stage, 'di ba? We give them or we offer them choices, or as much as possible at least very simple yung response ng pasyente natin. We also have here communication boards such as the use of whiteboards or maliit lang na chalkboard. Dun na lang kayo mag-uusap with your patient if they're unable to talk already. Okay, now let's continue with the next one, and that is on hemorrhagic strokes. For your hemorrhagic stroke, there is extravasation of blood in the brain. Extravasation, paglabas. What are the common causes? We have intracerebral hemorrhage, subarachnoid hemorrhage, cerebral aneurysm, and we also have here your arteriovenous malformation. So in short, there is bleeding, rupture of blood vessels causing bleeding or leading to bleeding. So we have here an illustration of an aneurysm. So in your aneurysm, there is a weakening of the blood vessel. This is usually due to, this may be due to hypertension. So because of excessive pressure in the blood vessels, it will now start to thin and it will start to weaken. Kaya nagkakaroon ng outpouching. And eventually, pag nagkakaroon ng severe weakening of the blood vessel, of course, that could rupture anytime. The problem with your hemorrhagic stroke, the bleeding or the fluids that will now start accumulating in the brain will increase the intracranial pressure. So, ang pinaka-problema natin in hemorrhagic stroke is increased ICP. So, our pinaka-target or our main target for ICP, increased ICP, is to lower the ICP of our patients so that this will now prevent further damage to the brain. So for hemorrhagic stroke, the normal brain metabolism is impaired by interruption of blood supply. Aside from that, there is compression of the brain due to increased ICP. So again, this is usually due to rupture of intracranial aneurysm. We have here atrioventricular malformation, subarachnoid hemorrhage. So what are the signs and symptoms you would expect in hemorrhagic stroke? Number one is always sudden and severe headache. So parang sinasabi ng pasyente, parang medyo may hindi bigla-biglaan na lang ako nagkakaroon ng masakit na headache. That is very important to note because baka pwedeng hemorrhagic stroke yan. Same neurologic deficits as your ischemic stroke, loss of consciousness, meningeal irritation, and visual disturbances. So yan, this is an illustration of common areas affected by hemorrhagic stroke. Usually kasi dyan nagkakaroon ng aneurysm, dyan nagkakaroon ng weakening of the blood vessel, yung mga arteries dyan. It's because dyan usually nagkakaroon ng concentration of blood. Because of that, if there is rupturing, this can eventually lead to bleeding. It's very important also that we have to understand which side of the brain is affected by the stroke. We have here destruction of brain cells caused by reduction in oxygen supply. Diagnostic tests, CT scan, MRI, lumbar puncture. Lumbar puncture, you're going to insert a needle into the spine and we're going to aspirate some CSF fluid or cerebrospinal fluid for analysis. However, we do not do this or we do not implement lumbar puncture in the case of increased ICP. Pag walang high pressure in the intracranial or pag hindi naman mataas ang pressure dun sa intracranial area, pwedeng mag-lumbar puncture or lumbar tap. Nursing interventions for this one, it's important that we optimize cerebral tissue perfusion. We have to relieve sensory deprivation and anxiety, and we have to monitor and manage potential complications of the stroke. So in this case, I mentioned to you about sudden severe headache as one of the main symptoms of hemorrhagic stroke. So we have here the stroke continuum or what happens during the stroke or usually yung stages or process of stroke. So ang pinakauna na na-experience ng pasyente is usually TIAs or transient ischemic attack that lasts for less than 24 hours. However, if they are uncontrolled, they last for more than 24 hours. We call them already as reversible neurologic deficits. And eventually, if they start having infarction or death of tissues of the brain, that is already stroke in evolution and eventually leading to a completed stroke. So there are different classifications of the stroke according to timeline or what happens or kung anong stage nangyari yung stroke na yan. So we have here TIA and eventually your reversible ischemic neurologic defects, stroke in evolution, and lastly would be the complete stroke. So what are the clinical findings of CVD or cerebrovascular diseases? We have here syncope or yung feeling na parang nahihilo, headache, changes in level of consciousness, transient paresthesia. So we have here in transient paresthesia, usually that is associated with TIA, and we also have mood swings. For objective data for CVD, you would notice convulsions, hemiplegia or there is paralysis on one side or pwedeng hemiparesis or weakness on one side. It is very important, again, that we know which part or which lobe of the brain or hemisphere of the brain is affected. So it's either right side or left side or right hemispheric stroke or left hemispheric stroke. It's very important that we know which side is affected because we will now know or understand kung ano yung maging possible signs and symptoms we have to address in the patient. The left side of the brain, again, is important for logical reasoning, for logical activities or logical actions. For the right side of the brain, it is the one that controls creativity of the patient. So let's try to discuss what are the signs and symptoms if there is right-sided injury or left-sided injury or stroke. For right-side affectation, merong problems with or this will now control attention span. It is also responsible in controlling emotions. Ito pala, this would now refer to the different activities of the brain or different things that your specific hemisphere of the brain controls. So for right side, it is attention span, emotion, ability to solve everyday problems. What else? Reasoning. We have here judgment calls, memory, music and art, controlling the left side of the body. So pag right side of the brain, ang affected side is left side. Kung left side of the brain, ang affected side is the right side of the body. This is the one responsible for speaking, writing, reading. We have here math skills, analysis, and planning. So if there is right side brain injury or stroke, so there is already a problem with the left side of the body. So left side weakness, hemiplegia, or hemiparesis. We also have impairment in creativity, confusion, the patient cannot recognize faces, there is loss of depth of perception, and trouble staying on topic when the patient is talking. We also have here left side neglect. So the patient starts to ignore the left side of the body, trouble with maintaining proper grooming, and the patient becomes emotional, very impulsive siya. What else? Poor ability to make decisions and assessing spatial elements. So they cannot even determine shapes. What else? Ayan. We also have here denial about limitations. What do we mean by this one? Hindi nila alam yung mga limitations nila brought about by the stroke. Feeling nila, kaya nila, so pinipilit nila. It's again because of problems with the right side of the brain. The patient is unable to interpret nonverbal language. What else? They have very short attention span. For the left side of the brain naman, compared to the right side of the brain, they are actually aware of their limitations. Alam nila na hindi nila kaya because of the stroke. Right side hemiplegia or hemiparesis naman, aphasia or trouble formulating words or comprehending words. They are aware of their limits brought about by the stroke. So usually hindi mapoproblemahin yung wandering nila, hindi nila pinipilit usually yung mga gusto nila. Experience depression, anger, and frustration. They have trouble understanding their written texts, issues with writing, impaired math skills. Their memory, however, is intact. What else? They would have problems with seeing on the right side. So this is what we call your hemianopsia. The ones yung nahahati yung vision nila or visual field, or this can also lead to blindness, partial blindness, and other effects on the perception. What are clinical findings of CVD? We mentioned a while ago about aphasia, and that is problem on speech. It's either inability to comprehend or understand the speech or inability to talk. Dysphagia or difficulty of swallowing. Sensory, that is again because of impairment of the gag reflex, impairment of the swallowing reflex. Sensory changes, hemianopia for visual fields. Alteration in reflexes, altered bladder and bowel function, depende yan kung ano yung affected na area. CSF is also bloody if there is hemorrhage. So this is in the case of hemorrhagic stroke. There is blood in the CSF. Abnormal EEG, CT scan, and MRI. We also have cerebral angiography. They're going to put a dye into the blood vessel of the patient, and eventually they're going to scan the brain of the patient through an X-ray. And they will look into if there is any impediment in the blood flow. Signs of increased intracranial pressure, very important, especially in the case of hemorrhagic strokes. There's a problem with the perception of the patient. So if you're going to look at that, medyo banking inya, J visual field, ti pasyente tayo. For therapeutic interventions, what can we do for our patients with CVD? So we have here complete bed rest with sedation, maintain oxygenation. What else? Maintain nutrition by parenteral route or NGT feedings if necessary, especially if the patient is unable to swallow. So for medications naman, we have here anticoagulant therapy. We mentioned again a while ago the use of anticoagulants or blood thinning agents such as the TPA and others. In this case, we also have other anticoagulant medications. We have here, ayan, we have the heparin. In your heparin, we have blood thinning agents. Your heparin is given to thin the blood for blood clots again, for ischemic strokes and not for hemorrhagic. Heparin is for ischemic stroke. Again, it's very important that we monitor any sign of bleeding. So, anong specific na blood result or laboratory test ang tinitignan natin for heparin? We have what we call your PTT or your partial thromboplastin time. Thromboplastin time. If there is prolonged partial thromboplastin time, there is an indication already of bleeding. So we have to give our antidote for heparin, and that is protamine sulfate. Kung Coumadin naman ang binigay natin na anticoagulant therapy for our patient, we also have to watch out for bleeding, but in this case, hindi PTT ang tinitignan natin na laboratory result. We actually look into the PT. What is PT naman? That is known as your prothrombin time. Prothrombin M dapat to. Bin time. In prothrombin time, if the prothrombin time or PT is increased or prolonged, that is an indication of bleeding. So we have to give our antidote, and our antidote for Coumadin is vitamin K. Example is your aquamephyton. So for heparin, our antidote is protamine sulfate. Pag Coumadin, that's vitamin K. There are some instances that we mix both medications, heparin and Coumadin. It's because heparin is mainly for immediate effect or blood thinning. For Coumadin naman, it would take around 3 days before it will now take effect. So that is for our anticoagulants. We also have here other medications. Of course, we have antihypertensives. We also have glucocorticoids such as dexamethasone. This is in order to reduce cerebral edema brought about by increased intracranial pressure from bleeding, and it will also decrease intracranial pressure. Other medications we give to our patients is your osmotic diuretics. Osmotic diuretics. Ang osmotic diuretics such as mannitol is given to our patients to decrease intracranial pressure. Very important itong mannitol for patients with stroke. It's because yan yung ginagamit nila pag nagkakaroon ng increased ICP in the brain. Ang mannitol kasi or osmotic diuretic, it largely targets fluid that is accumulated or that has accumulated in the brain. Ang mannitol usually ang binibigyan nila sobrang laki ng injection dun sa may kwan. Tapos ina-IV push natin yan slowly. Very important to slowly instill our mannitol. Hindi dire-diretso lang. Sa bagay, mahirap rin kasi siyang i-push sa sobrang laki nung syringe na gagamitin nyo for mannitol. Loop diuretics are also given. Examples of this one is Lasix and furosemide to decrease blood volume in the body so that we can also decrease intracranial pressure. Of course, analgesics for pain and thrombolytic or fibrinolytic agents, as mentioned earlier, your TPAs. We have here your streptokinase and urokinase. An important nursing consideration for this one is, of course, to check for bleeding. Interventions, we have here surgical intervention. For our surgical interventions, where is my hand? Ayan. To relieve the pressure and control bleeding if hemorrhage is present. We also have carotid, sorry, I cannot see without my glasses. Carotid endarterectomy. This is also used to improve cerebral blood flow when carotid arteries are narrowed by arteriosclerotic plaques. So they're going to remove these plaques. Ayan. So that is for your CVD. What else? Ayan. So this is a shortened version of our nursing care. Again, airway and respiratory function must be maintained. Neurologic status should also be maintained. Presence of signs of increased ICP should be noted and be addressed immediately. So we have here causes of increased intracranial pressure. Ayan, we have here the following. What else? It's also important that we assess with lumbar puncture if performed and maybe performed if subarachnoid hemorrhage is suspected. Again, hindi lang natin ginagawang lumbar tap kung nagkakaroon ng increased intracranial pressure. Vital signs, of course, increased ICP, hyperbradybrady, hypertension, bradypnea, and bradycardia. Maintain patency of the airway by positioning your patient, suctioning, and inserting an artificial airway. Provide for drainage and expansion of lungs. Ayan, positioning natin yan. And oxygenation. Encourage deep breathing. We also have mechanical ventilation if necessary, of course. Involve all members of the healthcare team when planning the care and assist client and family for realistic goals. It's very important that we teach the significant others and how they will deal now with patients with stroke. Provide frequent oral hygiene. Use artificial tears of blink reflex is if blink reflex is absent. So for example, hindi na masyadong nagbi-blink ang pasyente, of course, this will result into the drying of the eyes. So we have to give them drops. Institute seizure precautions. Provide elastic or pneumatic stockings for both legs to prevent clot formation. Prevent pressure ulcers. Prevent muscle atrophy and contractures. And provide tube feedings. What else? We also have here assisting our patients with feeding, so NGT, or we're going to let our patients eat on the unaffected side kung kaya pa naman nilang mag-swallow. Encourage the client with speech difficulties on how to properly communicate. So we mentioned that also a while ago. Make a definite transition between tasks to prevent or reduce confusion. So in this case, at least allow the patient to finish the task, and that's the time you're going to put an interval in between another task. Attempt to prevent fecal impaction and or urinary tract problems. Create environment that keeps sensory monotony to a minimum. Orient to time and place, increase social contacts, and others. So these are our nursing interventions for CVD. We have here the last one, provide for self-esteem and others. So please take note of this ones for your quiz on Tuesday.